Morning, everyone. Welcome to our morning routine of preparing our body, mind, and also our hearts. We will deep breathe and we will stretch into that, and we will keep our mind here and now, and we will be um, really observing the thoughts as they come up. Okay, so that way we know what we are doing. Okay. I hope you can see me on YouTube and LinkedIn and also the Facebook. You can hear me on Noon Vibe. So let's start. Okay, let's start the routine with a Bastrika, which is done on empty stomach, and you sit down on a stool or a chair, or if you stand up, it's up to you, whichever one you want to do. I'm sitting down on a stool with my back automatically straight, and now we can really uh, do our stuff, in a erect spine, empty stomach, and take deep breath in for 7 count and breathe it out for 8 count. Okay, but in between you hold for 4 count. So let's start. Make sure you are erect, your empty stomach, and your abdominal wall moving up with inspiration and going towards the spine with expiration. Let's start. Breathe through the nose, 7 count. Hold it for 4 count. Breathe out as the abdominal wall goes towards the spine, 8 count. Okay, one done. I placed my right hand on the abdomen so you can see raising the abdominal wall and going down. 3 down. 4 more to go. 3 more to go. 2 more to go. Last one. There you go. Now let's do the second Bhastrika. Raise your palms with elbows bent and to the side of your body. And as you take the palms up, extending your elbows up, you take deep breath in. Go all the way up. And coming down, breathe out. I did 10 of them. This you can do on full stomach also, sitting down erect posture and do them up and down arms once in a while, maybe every few hours, okay, at work. That will be good for you. And the last one we will do with the preliminary breathing, clasping both hands and keeping them under the chin, and elbows are bent and to the side of your body here. Now raise them to the side. Raise them to the side all the way and let the head go back as you take deep breath through the nose. And on the top, open the mouth, whisper the word ah as you breathe out and bring the elbows down, head to the normal position. This is a complete diaphragmatic breathing. Three, 4, 5, 6, 7, 8. See, start always with the simple deep breathing in the morning, and you can carry it later. Okay, so let us do some stretching of the body associated with the deep breathing and keeping the mind here and now. And any thoughts come up, just observe them, delay them. Don't indulge, don't suppress. This is an important thing to do in the morning so that your thought won't take over you and you are functioning in the past or the future of the thought rather than being in the present and doing stuff. When you are in the present, when you pay attention, quality of your work will improve too, right? It's as simple as that. Okay, now let's start doing the stuff. Okay, stretching, right? That's what we want to do. So first we want to stretch the spine. So clasp both your hands and turn the palms away from your body so that camera sees the palms. And now they're intertwined with each other, clasping together. Then elbows extended forward. And now take the hands up over your head, stretching the elbows to the top. And twist to the left side, the body first. Then turn the head over the left shoulder to the back and look at something in the back, in the middle. 3 breaths there. Come to the center and stretch to the top and come to the other side, right side. Twist the body first, then the head over the right shoulder to the back. And come to the center and reach to the back. Stretch head back to the back, bend it back, the neck bend back, and the hands also trying to go back. Come to the middle. Now take the hands down towards your feet all the way. Elbows still stretched forward, and you take the hands down by bending at the lower lumbar spine forward. Bend forward and take the head between the knees. And come up. And let go the arms. Take 3 deep breaths here. Relax always. You have not heard about that. Relax and exercise. That is the beauty of yoga. You want to relax into the pose. You want to relax with the breathing. And you want to relax your mind in the present moment. Okay? Remember that. Relaxation while exercising, balance and concentration. These are unique things that yoga gave me. So I hope that gives you too. Now we're going to the other variety of spinal twist. Bring the right hand to the left shoulder and left hand to the right shoulder and keep it there. And twist to the left side. Turn your head over the left shoulder to the back. Stay there for 3 breaths. And bring back to the center. And this time to the right. Twist the body first. And turn the head over the right shoulder to the back. And come to the center and let go. Okay. That is for the second variety of curls. You could do back and forward too. And now we're going to do the other one. Take the right hand, place it on the left hip in the front, and take the left hand to the back and keep it on the right hip back side, and keep your spine straight and twist to the left. Body first, then head over the left shoulder to the back. Come to the center and go the other way. Left hand goes to the right hip in the front. Right hand goes to the back of the left hip in the back. And now twist to the right side. All the way. Come to the center and let go. So there you are. So now, show me your left hand by extending the left elbow forward, and camera sees the left hand up. Fingers are up, palm facing the camera. Now take your right hand and pull the fingers of the left hand towards you by bending the left wrist backward towards you. This is a light yoga we are doing, okay? So, and put the left hand down, fingers pointing out, and take the right hand and the back of the left hand and pull it towards you. Three breaths. And then show me the right hand to the front and pull the fingers of the right hand with the left hand towards you. Now turn the right hand down, fingers pointing out, and your palm is facing you, and you pull the fingers of the right hand with the left hand towards you. We are doing a hyperextension of the flexion and extension of the wrist, all the fingers also. And now hold on to the wrist of the left hand with the right hand and elevate the left hand above your head and pull it towards the right shoulder. We are doing the very light yoga. Now do the same with the, hold on to the right wrist with the left hand and raise it above your head and pull it towards the left shoulder. Okay, now bend your left elbow and palm is on the chest like this, and then hold on to the left elbow with the right hand and pull it towards the right shoulder. Now, right hand to the left shoulder, hold on to the right elbow with the left hand and pull it towards the left shoulder. Okay, the stretch feels good, right? And now place the left hand on the left shoulder and hold on to the left elbow with the right hand and pull it up, all the way up. Pull it down, then press the right hand to the right shoulder and place it under the left elbow and push it up. Push it up. There you go. See, that is how you do the simple stretches of the upper extremities. Okay, and now we're going to do some for the shoulders. Shrug them first. Elevate both of them by taking deep breath in And as you breathe out, bring them down. Simple. Shrugging the shoulder. 2, 3, 4, 5. 5 more. 4 more. 3 more. 2 more. Last one. See, there's a simple shrugging. Make sure you are breathing in as you raise them and breathing out as you put it. You can do this at Varkasana. Extend both your upper extremities to the side. Elevate them so that the palms are facing down, fingers are pointing to the outside, and elbows are extended outside. Shoulders relaxed. Now draw a circle with the fingers at the end of the fingers. 1, forward. 2, 3, 4, 5, 6, 7, 8, 9, 10. Do the opposite. 1, 2. Be deliberate with the circles. Breathe in and breathe out. 4 more. 3 more. 2 more. 1 more. There you go. Okay? Okay? And now we're going to do something that is important for you. As you do this, you will feel better with your back muscles in the middle of the spine. Okay, those are the ones that are weak. Raise both your hands to the front, palms facing each other. Right, elbows extended forward, shoulders relaxed, and both your feet are touching the ground. Now turn the palm away, outward, and now start to swim. Imagine you're a swimming pool, you're pushing the water to the back, right? And both hands are going so that they want to meet each other, but they can't reach each other, but they can press a pencil between the scapular bones. Imagine a pencil and you are crushing it. Okay, stay there for 3 breaths. And now bring the hands back to the normal, to the front, and elevate them above shoulder a little bit. Now turn the palm outward. Again swim. Push the water out of your way, all the way. And then crush the pencil between the scapula, imaginary. Those small muscles between the scapula, they become weak for a lot of people. Gives them shoulder pain, neck pain, back pain, and all that. It is a simple exercise you can do in the office, sitting in a chair. Now elevate the palms a little bit above, and still elbows extended, shoulders relaxed. Turning the palm outward, you start to swim. See 3 levels. If you can do them, few minutes in the morning, in the afternoon, in the evening, and you will have very strong muscles there. You can also do other things to help those muscles by having the Namaskar Mudra and taking both hands in front of your face up by extending your elbows and go up all the way. Take a deep breath in as you go up. Now, as you breathe out, bring the hands behind your head. Okay, slowly, deliberately, and feel those muscles are getting activated. Now, take a deep breath in, take them up, above your head, extend your elbows all the way up, and now breathe out and bring the hands behind your head. 2, 3, 4, 3 more, 2 more, last one. There you go. Okay, that is where your small muscles in the back will work. One more stretch that will really help you is clasp both your hands like this. You see, left hand is up and pointing up, and you bring the right hand underneath the left hand and hold on to the left wrist like this. Okay, in this posture, bend the neck down and place your left hand on the top of the head and pull it down. That will work on those muscles very well. The small muscles between the scapula. Surprisingly, a lot of people find relief of the neck pain and back pain they were having by doing this strengthening of those small muscles. You can hold on to the weight and take the hand behind, and the weight is in the hand, go up and down. That will also help you to strengthen those muscles very easy. Okay. Now we're going to go to the feet and come up doing few exercises for the lower extremities. First of all, keep both your feet firmly on the floor, your toes, your soles, and your heels. They are all clutching the ground. Now lift the heels up, 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 all the way up so that they are on the toes, right? And now take a deep breath in as you come up like that. And then as you take the heels down, breathe out. Continue to breathe out as you bring the toes up, bending the ankles. Okay, this is a very important exercise for the second heart of our body, which is the calf muscles. Okay, now let's go. Second and okay. Take a deep breath in, raise the heels. Breathing out, come down with the heels and lift up the toes and bend the ankles. 2, 3, 4, 5, 6, 7, 8. Okay, that is a very important exercise for your calf muscles. Do that all the time. You will have less of varicose veins, less of edema, and strengthening the calf muscles really helps your heart because they pump blood from below to the heart. Okay. Now, let's do the knee exercises. Knee is supported by the calf muscles and also the extensor muscles of the thigh, right on the top. Okay. So what you do is lift up the left foot and extend the, no, I'm sorry, lift up the right foot, extend the right knee forward as you take the deep breath in. And you breathe out, bring the foot down and place it on the floor. Do the same on the left side. Lift up the left foot, extend the left knee forward. 1, both knees are down. 2, 3, 4, 5, 6, 7, 8. Okay, do as much as you can do. Okay, and now we're going to go for the hip joint. Clasp both your hands, cup them around the right knee, and as you bring up the right knee and right thigh presses the abdomen, breathe out. Breathe in, take the left foot down. And do the same on the left side. Breathe out as you bring up the left thigh to press on the abdomen. This is very good for your constipation, bowel problems, back pain, and all that. 1, remember, you have to breathe out when you are bringing this up. Two more. Last one. Okay, you can do as vigorously as you want, as many as you want. Okay, that will help you in so many ways. It will make your hip joint flexible and firm, and also it will help your abdominal organs to have the pressure working on them. That is the massage we give the inner organs of the abdomen and pelvis, which is a very good effect on the metabolism. Okay, and also rejuvenation of the inner organs. Okay. So yoga is not just about limbs and the chest and all that. It's about the inner organs. So brain calms it down, heart opens it up, and really help the heart with the second heart. We talked about capsules and also all this breathing in and out. They all help heart. Now let's do something about the chest wall. Place the left hand on the breastbone like this and elbow extended and to the side. Do the same with the right hand coming upon the left hand on the top, right elbow bent to the side. Now release the right hand so that you extend the right elbow and goes to the side. Palm is like this. Deep breathing in as you do this maneuver and continue to do that by twisting your torso, your body to the right. And the right hand goes to the back. Turn your head and look at the right palm. As you breathe in, you go all the way back. Now start breathing out, bring the right hand back to the chest. Do this very slowly, deliberately, being in the present and really observing any thoughts that are coming up, but focusing on your stretch, on your sensations, on your breathing. Okay, do the same on the left side. Extend the left hand to the side, palm facing camera now. Now twist the body to the left and turn the head over the left shoulder to look at the left palm. As you breathe in, go back. As you breathe out, bring it back. Both hands are done, that's one. Two. Three. Four. Four more. Three more. Two more. Last one. Okay. So there you go. That is for the chest wall muscles. Okay. Now we're going to go to the elbows. Stretch both your hands to the side at the shoulder level. Palms facing upward to the sky. Elbows extended to the side. Neck is straight. Now breathe out and bring the palms towards the shoulders and place the fingers on the shoulders. As you breathe in, take them to the side. 1, 2, 3, 4, 4 more, 3 more, 2 more, 1 more. These are gentle exercises, stretches, but there is an alignment to the body, breath, and brain. There is awareness in the movement. So you want to take this, the energy generated, the deep breathing that you are doing, that activates your parasympathetic system so that you become non-reactive, okay? And really be in the present so that you are not carrying very heavy weight in your mind. Rather, you are giving attention to what is the task in front of you. Respond to that with clear mind, okay? Being in the present is the best way to be clear in that moment, and that carries till the end of the day. So this whole routine is designed to have our body better, our mind better, our heart better, such a way that they are enhanced to go and do whatever we want to do in life, whatever we want to contribute to life. Okay? This is not moral lesson. This is a common sense of getting our instruments ready for our work. That's all. Okay? People are not doing it. They're not slowing enough to do that for themselves. It's not selfish. It's like a comprehensive self-care. Okay, this is only part of the preparation of the body and mind. But there is nutrition, there is sleep, and you sleep better if you are focused all day. Okay, and not carry so many worries, so many things to the sleep. Okay, simple thing. Slow down in this modern era of fast, but then be quality work and then develop better products or better thing, whatever you do, better service. Okay. Seeing so many people with burnout and distress, I designed this for entrepreneurs or workers or anybody who is in the workforce, that they have to manage their own self in situations. And this gives you the inner resilience. Okay, cultivate that. Come and do the two A's. Be aware and be aligned. Aligned what? Body, breath, and brain. Okay. If you can remember that, it will be very easy for you to do this and develop that inner resilience we are looking for. Okay. Now we are coming to the hand and the fingers. Raise both upper extremities to the front so that your hands are in the front, and you do the wrist movement up and down with all the fingers open like that. 2, 3, 4, 5, 6, 7, 8. And tuck the thumb in and all the four fingers on the top of it and do up and down. 1, 2, 3, 4, 5, 6, 7, 8. Turn to one side, rotate. 1, 2, 3, 4, 5, 6, 7, 8. Opposite. 1, 2, 3, 4, 5, 6, 7, 8. Open the fist and make a fist. Open the fist and make a fist. Like that. Okay? There you go. Okay? Now come to the neck. Okay? Straighten the neck and then turn the neck slowly to the left. Slowly to the left, and take the deep breath in as you go to the left. As you breathe out, bring the head back to normal. Don't go to the right, just stay in the center. Now take a deep breath, turn to the right. And breathe out and bring it to the center. That's 1. 2 done, 3 more. Here, be very deliberate, very slow. Be aware of the stretch. Deep breathe into it. Don't do it quickly. Okay? Very slowly, deliberately, with awareness. 3, 4, 5. Okay? Now, all the way to the top, raise the chin, get the head back, take deep breath in. As you breathe out, bring the chin down to the chest slowly. 1, 2, 3, 4, 5, 6, 7, 8. Okay, that's enough. Now we're going to go and do something for our face with acupressure. Bring the left hand up to your cheek by bending your right elbow there, right hand on the right cheek. Press it down and release. 1, 2, 3. Bring up the left hand to the left cheek, left elbow bent to the side, and press the left cheek with the left hand 3 times and release. This will release all the tension accumulated in your face with your facial muscles reacting to the emotional states. The more you react, the more you are angry, the tension will appear in the face. Take both hands, put them on the temples, press and release. Press and release. See, in acupuncture, they use the chi. The chi is the same as the prana. Actually, prana was the head of the chi invention, and people from China came and learned yoga and took it there, and they converted to their culture, and they developed their own instruments. Okay, so clasp both your hands, place this on the forehead, press them down, release, press them down, release, press them down, release. Place them on the top of the head, press both hands down. 1, 2. Press it very well and then release. Okay, and then to the back of the head. 1, 2, 3. Come back to your normal self. Yoga is Sthira Sukham Asana, stable, comfortable position. So always be in your comfort zone. Okay, otherwise stop and take deep breaths like this. There should not be no pain in yoga. It should be done in comfort, in relaxation, with awareness. Okay, then you'll get the most out of it. Now, let's do other things. Okay. Okay. Now, let's go and do some real breathing exercises. These are very effective if they are done properly, but can cause problems if you don't do them properly. So first learn the technique well, okay? And then listen to the technique and do it with me. Learn it. If you have doubts, DM me, okay? But learn it properly and do it to your capacity. Don't compare, don't compete. Do whatever your body and mind allows you to do, okay? So first 3 are hard on the abdominal wall, but that's why you get all the benefit by massaging the inner organs of the abdomen and also the pelvic organs. So first one is called Kapalabhati. The way to do it is sit erect and keep the spine straight and keep the mouth closed. As you breathe out firmly through the nose, let the abdominal wall go inward. That you do up to 60 times, only breathing out and abdominal wall going within. Inhalation happens automatically in between. So focus on exhaling there forcibly by withdrawing your abdominal wall in. That you do for 60 times in a minute. But you have to do 5 to 15 minutes every day to get benefit. But you got to progress very slowly. Okay, first take only 5 or 10 times, then 20, then 30. Then stay there for a month. Then increase up to 2 minutes. Stay there for another 2 months. Then 3 minutes, like that. Okay, so keep my right hand on the abdomen so that we can see the movement of the abdominal wall. First, take a deep breath in. Now, breathe out as the abdominal wall goes in. That you do for 60 times. Okay, you can do rapidly, intensely, or as long as possible. Okay, but be careful. Do it very slowly. Okay. Now I took 3 deep breaths per slowing down. Okay. Now I'm going to do the abdominal metabolic stimulator. Agni Sara. Agni is the energy, the fire within the belly. Sara means essence. So in yoga, umbilicus is deemed as the energy center. All the nadis, the energy channels, some 740 or something, then they come are so many thousands of, I don't know exactly the number, but there are a lot of them come and focus on that. Okay, so what you do is you first take a deep breath in, then breathe out completely and hold the breath there. Don't breathe anymore. And holding the breath like that, move the abdominal wall up and down. Okay, that will be activated. You will get 6 packs much easier this way. Look at my abdomen. Okay. Now breathe in and come back to your normal self. So you understood, right? Sitting straight and really breathing out everything and holding the breath, and then moving the abdominal wall, activating those abdominal wall up and down. Even if you have a protuberant abdomen with a lot of fat, try to contract them and release them. Contract them and release them. That will give you tone for those muscles. Underneath the fat, they will be strengthened, but that will give you posture better and also energy flowing better, and your metabolic energy goes up quite a bit, right? So you will melt all that fat with the aerobic metabolism. Okay? So whoever is obese, whoever wants to lose weight, consider this to practice every day. Okay. The third one, we're going to do what I got tribandhas, 3 locks. Breathing out, contract the lower abdomen. That's the first lock, and you want to hold that. And also at the same time, contracting the upper abdomen. That's the second lock, and the chin to the chest, third lock. Assume these 3 locks and stay there for a few seconds. First, breathe out as you withdraw the abdomen, lower abdomen. Come up, and there you are. Now, we are going to do only 2 more today because there's no time. I have a meeting on the enlightened approach to diabetes. You guys will stay on the thing. I'm going to start the other Indian channel also, so that the Indians can come, and we'll do it from 9 o'clock. Okay, so two more, Anlom Vilom. Okay, make sure your right hand is prepared for the breathing. Using the thumb and the ring finger, we close alternate nostrils. Start with closing the right nostril with the thumb and breathe in through the left. Close the left, release the right, and breathe out. Now take the deep breath through the right nostril, close it, release the left, and breathe out. That is 1 second. Four more. Basically, you are breathing through one nostril, blowing out to the other, alternately. Okay, so that both nostrils can be equalized. Usually, they close up, kind of, one side for 45 minutes, the other side for 40 minutes. Not completely goes up, the flow goes down. Okay. Now we're going to do Auma. Okay, for this energy channels, right? You take a deep breath in, first say Ah, and you breathe out for 5 times like that. Each time breathe in and breathe out. That's for the abdomen. Ah. Now we'll say a few times for the chest. Ooh. Energy channels will be unblocked. Now, Ma for the neck. Okay. Ma. Okay, these are the Auma for energy channels. Now we're going to do Shambhavi Mudra to really identify who we are. We are the energy, the life force, that is the conscious being. You have that feeling, I am, that conscious self feeling, right? That is the one reality. It's not our body, it's not our mind. They are our tools. Okay, you emphasize those facts. Okay, taking deep breath. First of all, you put both your hands in Chin Mudra and place them on the knees. and tilt your head back, close your eyes, keep the gaze in between the eyebrows. And now take a deep breath in. And as you breathe in, you say, I am the conscious being. When you breathe out, you say, I'm not just the body or mind. We'll do Sanskrit and English alternately 10 times. Koham, soham, deham, naham. Who am I? I am the witness consciousness. I am not just the body or mind. They are my wonderful tools. Koham, soham, deham, naham. Who am I? I am the witness consciousness. I am not just the body or mind. They are my tools. Koham, soham, deham, naham. Who am I? I am the conscious being. I am not just the body or mind. They are my tools. Koham, soham, deham, naham. Who am I? I am the conscious being. I am not just the body or mind. Koham, soham, deham, naham. Who am I? I am the conscious being. I am not just the body or mind. With that, namaste. I'm done with our morning routine. I hope you had good results like I do. I feel relaxed, energized, and also focused. And I'm open my heart to serve the world. Thank you. And now we're going to go to the other room where I can get the Indian crowd also into this. On my WhatsApp channel, I'm going to open it there so that they can also listen to what I'm going to say about what is an enlightened approach to diabetes. Okay. And I think this is very important because I've seen thousands and thousands of patients in my career suffering from diabetes. Unfortunately, the number of diabetes is increasing. So I felt compelled to develop this system of enlightened approach to. You don't have to take any religion. You don't have to convert or anything. You just understand the principles of how our mind is working, how we are aggravating our numbers, and how we are approaching diabetes care completely wrong in my viewpoint. So I don't mind using medication. I don't mind using insulin. I don't mind using on the ADA diet. I don't mind exercising. But cannot be just disjointed something. You got to understand the whole thing and then bring your whole being into that. That's what I'm going to attempt to present to you. There is a book that is being written, and I just have to put it on the Kindle, and I will do that. There is a course also I developed on this because it is important for people to really be with it when they are doing this. Okay, so I'm going to do that with you. So first of all, this is the initial telling you what this is all about, and hopefully I can do a Zoom session too, so that people can see my presentations also. But now I'm just going to give a talk, and let me go take you to the other room. You are on the phone, Mumbai people, so I can easily carry that there. Hold on 1 second. Over the years, as I began to really treat diabetics with my understanding of uh, Eastern way of looking at things, um, I kind of understood the importance of the mind such a way. It's such a big deal, right? And then as we began to understand that, it has evolved and it is still evolving. But the need has grown more than what people are really doing. So standard mechanical approach, it doesn't work with diabetes. So you got to bring your uh, mind into it, and you have to bring your awareness into it. You have to understand what is the big deal about that. Okay, so that's what I'm trying to do with you all, and hopefully you will be with me. Uh, Let me start the other thing. See, diabetics are two types, right? Insulin dependent and non-insulin dependent. We all know the non-insulin dependents are many, and that is really provocated by our lifestyles, poor diet, lack of exercise, sedentary activity, and lack of sleep, and really not knowing how to use our own mind, right? That is the problem, right? So that's why it's always important to understand how we are using our thought to aggravate our diabetes. That is unfortunate, has become such a big deal. you know so a lot of people are uh, thinking a lot, thinking about the numbers a lot, thinking a lot of negativity about the number they see on the continuous glucose monitor, or continuously worrying about the numbers, continually. That is the one which is aggravating them, right? So you want to understand that. So as you understand that, and as you understand how your thinking is working, you will be able to better do everything for that. Okay, so that's why I've named this upcoming book as beyond numbers, beyond the numbers. What are you going to do with it? Okay, so that is where we are going to address everything, and how you are interacting with your own monitoring, right? Once you understand that, then it will be much easier for you to really get into that. Okay, so okay. What happened? It is this is okay. It hung up here. That's why. Danny, you hung up there. I don't know where you. I have to open on the Zoom bath again.
Needing more protein.
Okay. Okay. There you are. ಫೋನ್ ಬಿಟ್ಕೊಂಡ್ರೆ then I'm going to call again, okay? Video call this time, okay? Okay. Okay, hold on. Let me mute yourself. Mute yourself. Okay. Okay, there we are. Sorry about the disturbance, but I had to restart everything. Here I'm going to talk about beyond the numbers. It's a gentler way to live with the diabetes or an enlightened approach to live with the diabetes. Okay, how we are going to attend to what we see with the monitoring devices. A lot of people get stuck in the numbers. They're looking at their blood glucose meter or continuous glucose monitor, and instead of it's supposed to give you insight, they are kind of buried in their own numbers, looking at it and reacting to it in a subtle way, which increases their stress hormones, the cortisol, the adrenaline, and that doesn't help with their blood sugar. My friend Shalu, she is the one who was kind of made me do this, because she is diabetic and she was monitoring the continuous glucose monitor, and I kind of seen very clearly this same phenomena of getting stuck with their numbers and trying to treat them and then interfere with their own metabolism. So, what is this beyond the numbers? What is this gentler way to live with the diabetes? This is like an invitation to diabetic care with compassion, with clarity and humanity, because there's a lot of suffering because of the high blood sugars. People don't have quality of life, don't have the energy, and then also they have a lot of problems with continuing this, right? So why diabetes feels heavy for people is living with the diabetes, where it feels it is overwhelming. Diabetes itself overwhelming, but they can't eat certain things, they can do certain things, they can feel good, they can participate in parties, they can go to weddings and birthday parties and eat a little bit that they like. It's like a constant heaviness in their mind, because so that is not because of the condition itself that is there, but because of how the mind carries it, right? The weight comes from constant vigilance, You got to be aware of every day. Before it will be casual eating. Now it is a big deal. And the mental burden of decision making. All the time you have to make decision, right? And that is not good for you in the long run. Right? So that is what happens with a lot of people. And Chinaka, just mute yourself, please. So, and the emotional toll of feeling responsible for every number. You feel like, oh, I have to be careful about this, otherwise it doesn't matter. No, this heaviness isn't a personal feeling. It's a natural response to living with a condition that demands ongoing attention. That is there, right? And when we understand where the weight comes from, we can begin to set it down more gently, right? That is what you should do. Okay. Why are you not muting yourself? Oh, there it is. No, it is not. Okay. All right. Okay. So that is why I'm doing this talk, because this is a very important talk for diabetics, because they personally know what I'm talking about. Constantly living with that sensation, okay, and thereby worsening it. See, that is the thing. See, when the numbers become judgments, you judge them, right? Oh, I did not do properly. I'm guilty of this. I wish I had not done it. All those things go on. See, the monitoring turns into vigilance. Constantly you have to be vigilant. That's a pain in the neck for anybody, right? So what begins as caring attention, you start monitoring these things as I have to attend to them, I have to be careful and all that, to hypervigilance all the time. See, early glucose reading, every glucose reading, everything that you to do in the morning, in the afternoon, before fasting and fasting, and all that, they become like a test score. Like you are in an exam, you failed that and you got the failing grade, like that. Every meal becomes a calculation. You got to say, oh, how many calories are there? How many? So the very sensation I'm talking about, it's not talking about being aware of good foods and eating. That's fine. But then what is the reaction of your mind to the number you are seeing? How you are reacting is what we are attending to today. Okay. Every meal becomes a calculation, means that you want to say, I want to be in this calorie count, and if I go beyond this. But then you go out and you see something good in a party, you eat, then you're already beyond your numbers, and that's the problem. And usually your peace of mind slips away because of all this hypervigilance, and really feeling is a test to score. I failed the test, or the meal becomes like a calculation. It doesn't become an enjoyable experience anymore, right? Because, oh, I cannot eat that. I cannot. Yeah, certain bad foods are there. Certain things are the unscrupulous nutrition producing products. People, they do all this, heavy foods that are not good for diabetics at all. But instead of understanding all that, if you are going on eating them and reacting to them, there's a mess in your mind. That is the heaviness I'm talking about. See, when you care about your numbers, that can turn into control. Somebody is controlling you. Something is controlling you. So this desire to manage diabetes, well, that desire can become an exhausting task, exhausting, and then need to control everything in you. You may not be in control, right? So this rigidity, this exhausting mind, this rigidity, that creates a lot of stress, which actually make your blood sugar go higher. You may think, oh, after just thinking, no, you are reacting. You are acting like a cartoon number, and then your life becomes numbers rather than pleasant experience. You can do that by changing your diet, by doing, but then once you have corrected the problems that is aggravating your diabetes, you can be carefree, okay? And you can be eating what is really palatable to you, but good foods slowly, and also with awareness and savoring that, okay? So this is about how can we approach diabetes in a different way, in a reframing the approach. That's what this is all about, okay? I'm writing this book because this is important for people to understand. It's already, I just have to publish it. I will very soon. This time, this is a practical book, something that people read. What this book is not about is, it's not a diet book promising miracle foods. That won't be there in the book, okay? It's not a productivity manual demanding optimization. You don't have to do that, okay? And then against, it's not against medicine. You should continue your insulin, your medications that are working for you. It's not against monitoring. Continue to monitor, fine, and continue to your medical care with your provider. You go to your doctor, take advice. That's all fine. um, it's not a replacement for clinical guidance, not at all, okay? What it is about is an invitation to see diabetes as a metabolic condition. It's a condition with you. So you have to live it within a full human life. Okay? Suppose you have a car and you understand the abilities of a car. How do you drive? Right? Like that. Okay? And it is a guide to bringing calm and clarity to daily management. That's all it provides you. Okay? And it's a companion for living well, not just managing well. See, from my story of my friend or other patients, any number of them, all these people are managing the blood sugar, but they have no life. They cannot enjoy weddings or birthdays. That's a big part for a lot of people. They cannot enjoy parties, young people. They cannot really go to a restaurant and order something that is palatable because temptations and all. So life is shattered for them. They are managing the blood sugars, but they have no life. I think every diabetic knows what I'm talking about. Okay. So this is a clinical truth about stress and regulation. Okay. Modern diabetes care really focuses heavily on what we eat and how we move. Fine. Okay. And these matter enormously, not even enormously. They are diet, correct foods and exercise enormously matter. But there is another factor that profoundly affect the blood sugar. How? That is what I'm going. They're affecting the nervous system. So that is a big factor. How your nervous system really reacts or regulates and all that. Okay, when you are fearful, oh, my condition is going to kill me, or I'm not going to be well, I'm not going to do anything, and all that. That fear, I may lose my life. I may lose my, avocation or vacation, whatever I'm doing. So many fears are there, right? I may lose my limbs. I may lose my eyesight. All these things are there. And the more you read about it, the more you understand it. It's like a blood vessel disease from head to toe. The blood is not going into the cells, not getting proper metabolism. That's why it accumulates, it causes problems in the blood itself. And those blood vessels are diseased, those organs are also diseased, right? So when fear dominating you, the stress hormones like cortisol and adrenaline, they rise. Very commonsensical thing, right? So these hormones, they increase insulin resistance, right? And really raise your blood sugar. Physiology literally tightens, right? Or you can look at the other way. When calm returns, you're not afraid anymore, your parasympathetic nervous system is stimulated and you are, that is activated, the inflammation decreases, right? And then your insulin sensitivity often improves. That regulation of the blood sugar becomes easier because you are calm. Not through effort, but through ease. Lighten up, ease up, don't be fearful. You're doing what is needed and all that. Why do you have to impose this fear all the time? That is easy to say, but the people who are in fear, they have to understand and they have to encounter the fear and reduce that. Okay, that is what I'm going to show you. Okay, so this is not alternative medicine, it is established physiology. But alternative medicine or beyond that, they understand much more than we do. So the way we hold diabetes in our minds directly affects how our bodies respond to it. That's the main point. Okay. So what we really talk about in diabetes care is stress hormones and blood sugar. So the biochemical reality that chronic anxiety raises blood sugar independent of diet, and what to do about it with compassion rather than more control. So when the patient comes to me, that's what I want them to see. Somebody understand their problem, or somebody is compassionate about the state of affairs and really gently leading them to the way that they can manage themselves. Monitoring anxiety, that is there. If you are continuous glucose monitoring, that is supposed to give you insight into how the blood sugar is going up and down, right? And you can do frequent testing, but that can be paradoxically increase your sugar. Your stress is increased and your blood sugar also goes up. So this monitoring creates a feedback loop that makes regulation harder. You see? So if you take insulin without shame, remove the stigma. Like if I'm on the insulin, I'm going to have cardiac arrest, I'm going to never be off of it, let me not do it and all that, that is a big factor. See, if you can take insulin without shame, then removing that stigma, that will be very good. And also, you are always judging yourself, right? So around insulin therapy, oh, I'm taking so much because I'm so bad at my diet and other things, that kind of thing. And recognizing it as a sophisticated medical support rather than personal failure. You have eaten food that has burnt out your pancreas. That's why you don't have enough insulin. That's why you're replacing it. So a lot of psychological attachment, a lot of misinformation forms there. You need the insulin, you got to give the insulin. How you use it according to your work, your routines, your metabolism, so many factors are there. Follow your medical doctor because they manage your hemoglobin A1C and your fasting blood sugar, your postprandial blood sugar, and then determine your nutrition needs in the daytime and at night, and how much you can really uh, use insulin. Okay, that's a mechanical really, but then we make it much more complicated by our psychological approach, by our thinking approach to it. Okay, so if you can understand the healing power of purpose, and also healing purpose of connection, when you are with people, with connect, you feel much better, right? And your routine and joy factor, if you can understand all this, then these elements, they stabilize both your mood and metabolism. This is something in ways the numbers cannot tell you. They cannot capture that. So what we're really talking about is what is the relation between the stress hormones and blood sugar? What is the anxiety that is delivered by the constant monitoring?
have feels like fear and shame that we feel, and also we don't have meaningful activities, meaningful things. Suppose you are used to go and meet people, not for the party sake, but there's companionship, camaraderie, friendship. My sister used to go to a yoga ashram, yoga, not even ashram, yoga teaching school, and she made a number of friends there, and she was feeling so good because she has something to go to. She has people that anticipate for her, and they treat her like she matters there. All those things matter for her to feel good, and her health was better that way. Okay, but then they had to move away from that area due to their own living arrangements and all that. They're living in a villa, much better place, but she's taken away by that social connection. You see what I'm talking about? So that is also important to understand. Okay. So you can reframe insulin itself. So insulin support is not a failure. You need insulin support because you kind of burnt it out by eating too many carbohydrates, dumping, and then pancreas produces all that it can do, and then beyond its capacity, it gave up, right? So for many people, many people living with diabetes, so insulin taking is represents a failure for them. Yeah, there is a way to really not to take insulin, not to take any antibiotics, and do the yoga, do the other things, and then be careful with the diet to go on. So there are there, but that could be too much for them, right? So they see if I'm taking insulin, that means I'm failed in my diabetes care. It's not so. It's not so at all. It's a support. It's not a failure. It's a precision tool, I would say, that does what your pancreas cannot do. Precision tool. Okay, it does not define your identity, your word, or your discipline, right? So, starting insulin isn't giving up, it is choosing effective care. That's what we do when you come to me with a very high blood sugar and you are already beyond the medicines and all that. So what is happening? Hi Shalu, this is supposed to be for you, and you are late.
I know, Dr. Rao, I rushed
No,
to join.
it's already deep into the talk, but that's okay. So actually, this is inspired by you, what you told me about the diabetes, and then that got me a lot of memories about so many patients whom I talked to about this, and then made them not think too much about it. So insulin taking is not a failure. It's a precision tool that does what your pancreas cannot. Okay, it does not define your identity, your worth, or your discipline. See, starting insulin isn't giving up, it is choosing effective care, right? When insulin is approached with acceptance rather than shame, adhering to that, improves and outcomes follow. That's all. Because you had insulin before with the pancreas, that is got exhausted by your food habits or cultural habits. What, for example, we were raised on rice in India, South India, right? Now, South India, the Andhra Pradesh, where I'm there, even now, it's the capital of diabetes because they have this habit of heaps of rice with a few vegetables, curries, and all that, right? That's exactly opposite you should do. You should have a small amount of, maybe limit yourself to maybe half a cup of rice and then eat everything. Then the taste will not go. You feel better. I ate white rice last night asking for it. I'm not worried about my diabetes and all that because I eat only when I'm very hungry. I eat slowly and I eat with real savoring the taste. The rice with chutney, avkai, we call it mango chutney, and some potatoes. This is what I ate. And I felt very good because I ate only limited, I ate very slowly, I savored the taste. So I'm happy with the meal, right? That's you can have it. Okay. So remember, insulin is a precision tool. Okay. So you can reframe insulin response. Okay. What you cannot postpone is how you live. You can be joyful. It's not contingent on something else. Okay. Meaningful movements. They don't require perfect numbers. Okay. You have connection with somebody that is like my friend Janet is coming up all the time. And Peter also comes up, and I love them, and they know it. And that meaningful connection feeds them and me also. Right, Peter?
We love you too. Namaste, Dr. Rao.
Namaste.
We love you too.
Yeah.
You know, what I really love also is how you always approach it by treating the whole human being, right?
Yeah.
And with such compassion, you encourage us not to label ourselves based on particular medical condition. In this case, diabetes, taking insulin.
Yeah.
I think it's because I know that I have had the tendency to identify with whatever illness or ailment I had when I was dealing with the mental health issue of addiction, like
Yeah.
the I am an statement. It's very important to treat ourselves with that type of passion, to separate ourselves from
Yeah.
our particular conditions. I just love that you do that.
Yeah, because if you look at commonsensically, that's what it is, right? It's a condition. It's not the whole of us, right? So, but the thing is, people are not talking about this. If I say joy is not contingent, it can be with your connection with somebody, friendship, okay? Or you laugh together, or you see a movie and laugh together, and then you can celebrate an occasion. Somebody else's birthday, we celebrate it, right? And then that's
Yes.
all these movements of joy, they're not contingent on being your numbers correct. Actually, they help you better to control the blood sugar.
Yeah.
See, this is a book I'm writing also to complete it, almost complete. This is about apart from your treatment, whatever you're taking, whatever activity you have. I'm not disputing any of that. But what I'm saying is, with what kind of mind are you coming and approaching your numbers?
So important.
Actually, this book gives you a lot of insights into that. Okay?
Right.
So this is not a book about diet, it's not about optimal exercise. They may be there, some of the things that I will tell you about. What is a ADA diet, what is a Mediterranean diet, what is a Sattvic diet from the Ayurveda, what is a real vegetarian diet. All those things will be there, but that's only for choice. People can choose them,
Right.
But that is not what this is about. It's about heaviness of your mind that you are allowing to spoil your control.
Yeah.
See, the story.
I was thinking about the recent problem I had with my blood pressure elevated.
Yeah.
And right now I'm on a medication to stabilize that.
Yeah.
But I'm thinking beyond the prescription, beyond the numbers of what my blood pressure is.
Exactly.
It's stable now. I check it twice a day.
Yeah.
But I made adjustments to my diet, realizing that.
You are inspiring me to write a book on hypertension with this perspective. I will do that.
Oh my gosh. Yeah. It's so very important. And I realized that, hey, I'm an African American male.
Yeah.
I'm predisposed because of my
No,
genetics.
you are a human being first. African American male later. Yeah.
I agree with that. But what I'm saying is, in my body, there's some physical facts there. There was diabetes in my family.
Yeah.
So I really need to be a little more cautious and a little more aware of what I put in my mouth. And more than that, I think how I consume the food that I eat. And we've talked about that before.
Exactly.
About eating mindfully, chewing my food, because digestion starts in your mouth when you're chewing your food. That's when it starts.
Look at the example I gave, Peter, last night. I'm not supposed to touch white rice, but I asked for a white rice, freshly made, and I took only limited, but I enjoyed it for 20 minutes. Small amount of rice.
Right.
You know what it is? You got to savor.
Yes.
And then you got to
Yes.
chew. How that works for diabetes is when you chew slowly, you will secrete lot of saliva.
Yep.
If you grab it and then gulp it, then you don't have the choice to generate. So 1/3 of stomach will be with your whatever food you are eating, and then
Yeah.
another 1/3 with the saliva, and you leave the 1/3 alone.
Yeah. Yeah.
People are consuming a
Yeah.
lot without chewing, this is a very simple thing to do. But people
Yeah.
don't slow
Digestion
down.
it's a chemistry of digestion. That chemistry
Yeah.
starts in your mouth with your saliva and how you're chewing your food thoroughly.
Yeah. It's the amount of saliva
And
I'm talking about that fills your stomach.
Yeah.
See, a lot of
Yeah.
times satiety doesn't come unless you have the stomach expanded to a certain degree, right?
Right.
That usually takes up to, in time, 20 minutes. Okay? In other ways also, if you look at it, it becomes such an important thing to do that. Okay? So it's a question of having that kind of slowness, attention, and enjoyment of the meal. You don't have.
Greetings.
Hi,
So nice to you again, Dr. Aaron. How are you?
I am
Queen
fine.
Be Fine.
Yeah. How are you, Queen?
I am so happy to hear from you, and I love this conversation that you're having.
Yeah.
I love the digestion.
Yeah.
When I had as an African American woman, which it was nice to hear you speak, Peter. As an African American, I had to learn that just because I came from a culture, and they eat certain foods, I couldn't continue that tradition because I had to elevate from that way of living. And I had to really focus on eating food that were not only local, but according to my blood type, my weight. And I have to be conscious, which taught me to live. And I love the fact that you said digestion starts in the mouth. And that's how I live spiritually. Like when I get food, or even when I have a conversation, I don't gulp down a conversation. I savor the conversation. And I love that word that you said.
Yes.
Savor. I savor the conversation, and then I take in everything, whether it be a conversation.
Yeah, you are living when you are savoring the conversation, Queen. You are living. You are enjoying yourself and you are savoring it.
Yes, and even water. Like when I learned a new way of drinking water. I'm sure people have been doing it for days and years and decades.
Yeah.
But I learned that if I really want water to do the job that I believe its purpose, to hydrate, to flow, I have to start sipping.
Yeah.
I don't gulp water.
Exactly.
I sip it.
Sip it. Yes, exactly. Very, very true. Because a lot of people don't slow down to sip it.
Right. Yeah, exactly.
Actually, there is a process for the water drinking early in the morning, Queen. When you get up in the morning, don't brush and drink water. Why? Because some of the bugs that you have will be your own probiotic.
Ah, okay. Yes. I've learned since the last 3 years to not to just incorporate new ways to elevate my mind, body, and soul, but make them a lifestyle, a new tributary to who I need to be to get to that way. I'm not going back. Yeah. And I hear a lot of people, I'm blessed to speak to people post-COVID, who are not afraid to communicate.
Yeah.
That they realize that in that space of after, eating and you have to be conscious of how you eat now.
Yeah.
I don't think we had what our parents or foreparents had.
Queen, I named one of my ebooks as a conscious plate.
Right.
You got to be conscious about the foods, you have to be conscious about how you eat, you're conscious about the taste that you are enjoying. All that brings it to the present moment.
Yes, the present moment. And and that's why I love listening to you, because it reminds me, and every day I need constant reminder, because I am a being of elevation, let me tell you.
Yes.
To be reminded that I must be in the moment and then to enjoy a moment fully, I have to sip it.
Yeah. For me,
I have
being
to
in the
sip
moment
the
is
moment.
life. Is it? We are really living when you are in the moment.
Yes. The answers are here now.
Yes.
Even as a dream interpreter and a woman who loves to live off the earth, because that's who I am. When I look at the world and I say, you know what? In order for me to see my answers, I have to really be in the moment, because the answers are always in front of you.
Yes.
No matter what you're doing or how you're doing, whether it be a color, a light, a feeling, a texture.
Actually, this is a very important point because I talk about being perceptive versus working with the data.
Yes.
Suppose the queen is there and I'm seeing queen after a long time, but if I have some image about her, I'm not listening to what she's telling me now. See, I'm in my mind relating to what I imagined about her. But if I listen to it, queen is really living in the present, queen is enjoying the meal. All those things are something I can see right now.
I love this moment. I sip this moment with you, Doctor.
Yeah. So it's I think that's very important. You see, that's what I talk about. Either you are living in the present or you are living in your mind, past. And so some of the external things that is important that we need to have the learn lessons and implement them to improve the quality of the things, whatever we do outside of us. But when it comes to inside, and this is important with diabetics too, you cannot think through your anxiety, worry, shame, fear, all these things, and then expect your numbers to be bad. So in the present moment, do you have the fear, or you recollect so many things and you're afraid? In the present moment, do you have fear, or do you see what is there without your imagination of something bad happening or something in the past happened to memory? All that. You cannot take away fear with a drug. What you can do is you can face it. You can see what it is. Then it will disappear. Right? So living in the present is very important for diabetics. I'm going to show in this book what are the inner mechanisms that we are doing that is causing the heaviness of this diabetes on us. For those diabetics, not only my friends and other people, but also the diabetics who are fighting the battle for years, but then in the battle, they lost their life already. They can't relate to people, they can't go and attend parties, they can't enjoy occasions, social occasions, all that because they have this heavy threat. Don't take this. And the longer they live, the heavier it becomes. There is no need. That's my argument. There is no need. That's why this book, along with that, I'm developing a 12-week course for those people who seek to work with their numbers and work with their condition and with me. Then I'll be able to meet them twice a week, for those 12 weeks, and let them start doing it, and then come and discuss with me what's happening, what's not going. So they have not only learning each session, but also seeing their progress, seeing where they could make arrangements and all that. Usually, the sessions help them to really relax their worries and also not be fearful, eliminate all the, clearly identify what is that I am doing that's making my diabetes worse without me knowing. Once you are educated about them, then you will be able to look through that. Okay, so that is why this course is being offered, and then people can enroll into that after I really announce that. But I'm telling you, I consider the suffering that diabetes going through can be handled better once you have this perspective I'm putting in the book. But to contain that, you have to understand what are your conditioning factors, how you embracing only thought but not awareness. That's a civilizational change. When ancient people were in the awareness, they discovered tremendous things. But this intellect-based only thought is actually causing a lot of problems for the modern generation. So all those things will be there. I only take the wisdom from ancients or this one. So as I told you, this book is not about diet, it's not about productivity manual, or it's not about against medicine or against clinical guidelines. No, it is not. It is about an invitation to see diabetes as a metabolic condition only. Like Peter was talking about, hypertension is condition, that's all. And you can live any of these conditions within a full human life with certain things. But you don't have to fixate your mind on that and then allow that condition to get worse by eliciting reactions within your own mind. So this is a clinical truth, stress and how you regulate diabetes and all that. Okay. So as I said, joy is not contingent. Okay. So meaningful movements don't require perfect numbers of blood sugar. So your connections can be good, your laughter can be good, your celebration, they can be spontaneous. Not, you have to get rid of this weight on the mind. And then what matters now is your experience. If you have the richness of life, it could be just seeing your grandchildren, and you want to go there and play with them and be with them. That richness of life, I don't think money can give you. But it exists in the present moment. Suppose you go there and you're occupied with your blood sugar numbers and you cannot eat anything, you cannot share anything, you cannot cook anything for them because you think, oh, I'm a cheat myself, I eat and my numbers will go. So a lot of things are robbed. See, in the present moment, not in some future version where everything will be controlled, I'll be happy. No, don't do that. We enjoy the present moment. My friend Janet, she tells me all the time, she goes to see her grandchildren, she loves it. That's a good thing for her. And she is able to get out of the chair and go there because she applied herself to morning routine every day and did them, found out what they are, discussed it with me and all. That's what I would like to look at. Say, another thing is how the rest can be productive for you. Usually people think rest is a waste of time. I'm just sleeping for so many hours, I'm wasting my time. It's some product, some nonsense, something they want to create outside. Maybe build more buildings, or build cars, whatever. They are important in that way, but they are not so important as your mind and body, everything resting. Downtime. How much downtime you have? How much pleasurable moments you have with your nature, with your relationship, with your activities that you want to do, and how much ease is there in your activities, in your relaxations, in your ease of the body, ease of the mind, ease of the emotions. They are not there in the modern time because they're always putting you external goals that you should achieve. Then you will be successful, then you will be joyful. Now, you can be joyful, do very well, and then taste the success also. But not success is everything. Success is here when you can really be with yourself, calm down your mind, calm down your body, and really enjoy yourself in the present moment. So they are essential components of well-being. Okay? See, if you postpone this living experiences I'm talking about until the numbers are better, okay, you miss a very profound truth. Sometimes the numbers are improving because we started living, enjoying ourselves, experiencing that camaraderie, friendship, or affectionate relationship, all that. See, usually numbers follow life. But diabetes, what they are doing is other way around. See, because we have been taught that good numbers create good life, right? But clinical experience, at least mine, reveals something more nuanced. When people, they find meaning in their activities, in their relationship, in their whatever they do, and they have established a rhythm. So I talk about working in flow, right? That you can learn. I can teach you, but you have to be very essential about it and sincere about it. You can reduce your fear, for example, and you can reconnect with whatever that matters to you. Then the metabolic stability follows because you have done this, not because numbers improve and then I'll feel better. No, you improve better inside your mind, inside your emotions, inside yourself. That reflects on that's why yogis were silent in their mind, realize their self and settle down there. So that's why their mind doesn't move, doesn't produce a lot of stress hormones. It's as simple as that. I beg and ask people, be calm for 5 minutes in the morning, 5 minutes in the evening. I don't think many people call me back and say, we are doing that every day. You got to do every day. And also I showed so many ways to be in your awareness and use the thought, not the other way around. You think thought is first and then awareness, but you are aware of your thoughts means what? Awareness first. Okay? So what we are talking about here is, there is, once you are clear and you have space within your mind, you can handle, reduce your stress. See, mental calm lowers the cortisol. That improves the insulin sensitivity. So that is the first thing. Remember, spontaneous spaciousness reduces stress, okay, in the mind. And if you are doing meaningful activities for you, that is supporting your routine, that purpose makes sustainable habits easier to maintain. You got to have a purposeful life. Like my thing is, Jagat Hitaicha. First, Atmano Mokshardam Jagat Hitaicha. First, work your own liberation, finding your true self, not your mind, not your body, but beyond that. Then I can use the instruments of body and mind better. I repeat this every day in the morning routine, right? So that is my purpose, finding my own inner self, and then going and working for the welfare of the world. Then, if you are connected meaningfully, like, me and Peter, me and Janet, we all have friendships. We never met, but there is a connection. And that connection heals both of us.